Hello, class. We're starting to move into week three. I just got week one discussion board all graded. I will work on week two after tonight. And I will also be working on your Guardian um, papers. I hope things are going well. I If I'm noticing any trends that I need to address, I will address it on lecture or through the announcement. So please make sure that you check your CBU email. That's actually the only way we're supposed to communicate is through your CBU email. So if you need to reach out to me, use your CBU email as well. But I hope you're learning a lot. This stuff is very interesting. Again, especially when you're in the middle of raising children or are about to raise children or have are in different life seasons with grandkids or, considering. There's a lot of great, interesting things in here. If you've worked even in education at all, you'll probably be able to relate to a lot of the things that we're talking about. Um, so kind of starting off, we're in chapter 5. We're just moving right along in the text. And talking about stranger danger, talking a lot about attachment, which attachment is huge in children. But Erikson talks about the 5 different stages. The first one being the basic trust versus mistrust. And it's when parents consistently respond to the newborn's needs, so there develops a trust. And we want a good balance of trust versus mistrust. With the proper balance, there can be more openness to new experience while knowing the possibility of danger. So we don't want kids to be too trusting, causing them to maybe put themselves in a harmful situation or trust a harmful person. But we also want them to be independent and to be able to do things on their own, but also knowing that there's boundaries. Okay, the next stage is autonomy versus shame and doubt. Understanding that they can control their own actions, and then the other side of that is not realizing that they can do things on their own, which causes doubt and shame. So again, we want a blending of the both, a balance, that they can, interact in a way that is positive in their environment. And we don't need to have shame, or guilt. And a lot of people have that. And that's the way, too, that parents, I think, sometimes discipline is by shaming, which is not good for children. Initiative versus guilt. So initiative conflicts with guilt, right? So one's initiative may clash with goals of others. So the balance between the individual has initiative with and willingness to cooperate with others. Like you're seeing a kid being willing to have maybe an idea, but also willing to work as a group, which is huge, right? Especially when you look at them when they're little and they're trying to determine, they can be very possessive and all into their things, but seeing them being willing to share or include is huge. Now, according to Bowlby, which there's a really great book, Becoming Attached, that he's written, children that form an attachment with an adult are more likely to survive. Okay. Which is really huge. And I'm sorry, I said we were just talking about the first 3 stages of Erikson. I know I said 5, but we were just talking about the first 3. I apologize, I jumped ahead. So I just wanted to clarify that. But attachment. Okay, so there's 4 phases of attachment. There's pre-attachment, which is birth to 6 weeks. Now, attachment can even start taking place, and I know this sounds very strange, but in the womb. A lot's going on in that time with an infant growing inside the mother's body. All kinds of things can affect the baby, right? So mom can be bonding with the baby already during that time. Even the type of a pregnancy can affect maybe some of the bonding that takes place if it's a really hard pregnancy or really stressful, or maybe something stressful happens. I've had women who are going through like maybe a very hard marital situation in the midst of a pregnancy, and there's just not feeling very attached to the baby just because they were in survival mode dealing with all these other things. But when a baby is born, the recognition of their mother is huge, right? They know their smell, their heartbeat. Um, these are things that nobody else can replicate in a sense, right? They identify with you because they've been living inside of you. Okay, attachment in the making. So 6 to 8 weeks through 6 to 8 months. They interact with the caregiver. They know who the caregivers are. We develop a true attachment. So single out the attachment figure and show them trust. And there's a reciprocal relationships. So the infants are able to initiate interactions and understand the parents' feelings and goals. So they're able to have like a mutual, loving, obviously, relationship. And obviously, for some kids, they don't get to have experience with that. Um, Mother is usually first with attachment, but soon after, the father develops an attachment. Sometimes for new dads, it can be kind of hard because one, the mother carries the baby. If the mother's nursing, she's nursing the baby. So dad's trying to figure out what his role is. And that can be a tricky thing for a first time dad. And so play is a great way for a dad to initiate the interaction. I think even for dad to take charge of, bath time or other things like that are huge. Just to be interactive and to engage, like I think it's a partnership with children. And even though maybe a mom might have have a very specific role in the time of an infant, a dad needs to be collaborative and come in ways he can. Skin to skin is huge. All those things are very important for a dad. So a secure attachment is when a child feels obviously secure with whom they're attached to. Babies may not cry as much when the mother leaves, but wants to be with her when she returns. This is common in 60 to 65% of American babies. Avoiding attachment is the baby does not cry when the mother leaves and looks away from her when she returns, so as if they're avoiding her, right? This is a type of insecure attachment and happens in 20% of infants. A resistant attachment is the baby is upset when the mother leaves, still upset and hard to console when she returns. This is also an insecure attachment and is 10 to 15% of American babies. You can see how this could be very difficult, right? And there's already so many feelings and emotions going on in those early stages. And you think of a person may not be in their best frame of mind because of sleep exhaustion, trying to figure out parenting. Every kid is different. This kid might be acting different than your other kids. And just the crying of an infant can be so, so hard. Not feeling like you could leave your kid with anyone because they'll be so upset when you get them back. I mean, there's just all those things. So you could see how this can be very stressful on parents. And a disorganized attachment is babies confused when mother leaves and returns. And this is also a type of insecure attachment. So just like it sounds, secure attachment, you're going to have a better relationships peer-to-peer. Insecure attachments can cause issues such as anger, aggression, anxiety that is seen in children later on. Secure attachment is most likely when parents respond predictably and appropriately, instills trust and confidence, right? Babies develop an internal working model, a set of expectations about parents' availability and responsiveness. And then temperament influences attachment, right? So fussy babies combined with rigid mothers can lead to an insecure attachment. So again, there are so many books out there on how to be a parent. The reality is there's no one perfect book, right, that you can read. I think back in my day when I was a baby, everyone talked about Dr. Spock. And now most people would be like, what are you talking about? I thought he was on Star Trek. But he was the man of that time talking about parenting. I know for myself, when I became a parent, there was two really big books that were out there. It was Baby Wise and Happiest Baby on the Block, which they're totally contradictory. And that's what's so hard is, everyone has their very differing opinions. There's nothing wrong with sitting down with your pediatrician and asking questions. If a mother is suffering with postpartum depression, going to a therapist, trying to navigate these things, obviously including your partner, is important, but trying to navigate all this because there's not necessarily right or wrong, and the reality is every kid's different, and trying to deal with all the things that are going on during this season is so hard in itself. So really trying to make decisions based on what you think is best for your baby, assuming it's not harmful or hurtful to the child, right? Because we want to do our best to not screw up our kids, right? That's the goal. The reality is we're not perfect people, you know, and we do the best that we can, and we just want to try to be the best versions of ourselves as a parent. So again, so basic emotions. So right, we have joy, anger, fear, interest, disgust, distress, sadness, and surprise. Newborns experience all these things, right? You can sometimes see that on their little faces. 2 months is when they start showing joy. When they are about 6 months old is when they start showing fear and some stranger danger. As kids grow, they develop more, and they get more emotions and more emotion responses. So they might be afraid of the dark, or they might see something that kind of startles them, their startle response. And so, you know, this is something that can be shaped too by where you live, what kind of emotions are seen, how people interact, what they're used to seeing and doing. That might cause, you know, them to respond to things differently. There's not one way that everybody does things. Infants can detect emotional face change in your face. Infants can also match their mothers, so act happy when their mother is smiling and talking. Infants look to their parents for a lot for their social cues. So again, regulating emotion depends on a cognitive process. Infants begin to regulate emotion by 4 to 6 months. So they can hide if they're scared. They may, by 2 years old, they may realize a sad facial expression. They might know that if they even give one of those, they might get a certain response from a parent. So when they start to regulate emotions as they get older, they rely less on others to regulate and then more on themselves. They come up with mental strategies to regulate emotion, and they match the strategies for regulating the emotion with a particular situation. And it's amazing that already at a very young age, they're starting to be able to do this. I say this often, but even young children can manipulate. I watch my kids, you know, like I said, I have young kids, and their way that they try to emotionally manipulate situations. Luckily, I know what they're doing, and I don't fall for it all the time. Probably sometimes, but not all the time. But like, it's not like I taught them that, but they know already how to try to work a system by being sad or upset or, oh, I guess that's just fine, you know, things that they say, and they're young and they already know those things. So kids know, you know, when you look at the little 2-year-old who's crying because they want their way, and then 2 seconds later they're laughing about something because they're really fake crying, but hoping that that will help get their way. You know, kids are funny. Okay, so parallel play, each child plays alone but is interested in what the other is doing. So maybe they like what someone's doing, they'll go still play independently, but maybe play side by side. Toddlers engage in similar activities, talk and smile at each other by 15 to 18 months. And cooperative play, which is playing together, happens around age 2. So make-believe progresses from the concrete to abstract. So what objects might a child use to play school? So they might literally have some concrete things, or they might pretend like they're writing with a pencil or on a chalkboard or have an eraser, right? They know what those things look like in their mind, and so they're able to replicate them in their play, which is very fun, you know, for kids to be making those kinds of connections. Kids can like to do coloring, puzzles, Lego, solitary play. It can be unhealthy solitary play if it's wandering aimlessly, hovering, watching children play but not engaging with them. They're just kind of observing. At 2 to 3 years of age, children prefer to play with usually their same gender. So children do this on their own. They resist playing with members of the opposite sex and choose to play with members of the same sex. Maybe because of interest, you know. That's something that they have noticed. Um, you know, kids tend to play differently. So boys prefer competition, girls prefer cooperation. So that could be some of the frustration there. Now, there's going to be boys who like cooperation, girls that prefer competition. That's fine too. But when we're looking at the overall general population, these are general statements. Um, Girls don't as readily influence boys during play, um, and boys are constricting actions to create competition. So, um, like I think of my kids, they don't sit still. They don't sit still at all. They're very busy. I have four boys. When I look at little girls, now I'm not saying there can't be very busy little girls because there are, but they have the more of the attention span to sit at one thing and do it for a longer period of time. My kids are all over the place when it comes to things. They'll start playing with one thing and then move right to the next thing. And I'm like, you guys didn't even play with this for like 10 minutes. um, and so that could be some of the frustration of why boys and girls don't play as much at a young age. Um, so again, parents can become involved with play, which we encourage. We think that's great. So they can play with the child, come up with play dates, um, how to help them work through conflict, um, and whatnot, which is super helpful. Like we don't want them to take over that, but help them navigate how to have conflict resolution because even little children can have conflict, right? We know this. Moving on to chapter 6, we're talking about the concrete operational stages, right? Ages 7 to 11. And this is when we see egocentrism decrease, realization that appearance can be deceiving, so maybe things aren't always as what they seem. Actions can be performed on objects or ideas that constantly yield a result, and abstract thinking has not yet emerged. And then formal operation period is ages 11 to adulthood. That's when you have more operations to abstract entities. You have more reasoning, deductive reasoning. Your brain is just developing, obviously, a lot more. How do children store information and retrieve it later? Children begin to use basic strategies as rehearsal, right? The more they practice, we see rehearsal done a lot in songs that kids sing as a way for them to remember things and learn. Think of just the alphabet song and how often that's sung and how catchy it is. And, kids may learn easier doing something like that versus looking at a flashcard necessarily. But if something's repetitive, it may stick in their brain, where flashcards and things like that can be helpful. There's specific memory strategies. So rehearsal for a string of numbers, outlining for reading a textbook. Children must choose a strategy and determine whether or not it's effective. So every kid is different with what's going to be helpful for them in remembering. Memory is something that can be looked at as a problem, and that can also be something that is tested for. Now, if you plan to work in a school district of some sort, maybe being a school counselor or being a licensed marriage family therapist in a school setting, I really do encourage you to understand school culture because they are their own culture, and to also better understand, you're going to need to know all about all the psychological testing because that happens a lot and is involved a lot with IEPs, which is an individualized education plan. And so for you to understand that and to understand what's going on in the testing is going to help you as a clinician better help your clients because that is something that happens often in school districts and nowadays through all the ages, kinder through senior year. They're looking at what's going on with kids, maybe what are some of the issues, and let's address them. So for you to understand those things, it would be really huge. So when we're looking at intelligence, goals look very different, maybe for different cultures. So with our skill set that we use for trying to see what's maybe going on with a child, it has to do with what we think would be best for our society, and what's motivating and things of that nature. So our testing may look different than maybe another nation's testing or what we're looking at specifically. So the mental age, which is also known as an MA, the difficulty of problems a child could solve correctly. So if a child could solve problems of a mental age higher than her chronological age, she was bright. A 6-year-old solving on the level of a 9-year-old shows that they're capable, right? This probably could go younger as well. Um, so again, all these different tests and test scores. Um, and it's hard because, this is what allows kids to get into certain programs and things of that nature. Um, Not all kids are fantastic test takers, and some kids may not test well but are very bright kids. So there's a lot of factors in there with the IQ testing. So environment is huge with kids, right? Especially kids in school. Children with high IQ scores generally come from well-organized homes with appropriate play materials. IQ test scores rose in the 20th century, and high-quality preschool programs can help low-income children do better in school. I was just working for a school district, and they had a program for preschool, and I think it really helped not only the teachers but the parents and everyone to work together to help these kids to better service them. And a lot of times I think there was some misdiagnosis, or maybe they just needed follow-up care in different ways. Because as much as testing and whatnot is huge and imperative, you know, there can be also different factors that are going on while someone is testing. So there's just a lot to take into consideration. Um, so I'm going to jump ahead to learning disabilities, which this is something that is being tested for. Um, so this is something that we're looking for, right? So is different kinds of learning, just not necessarily us, but maybe school psych, or parents may come to you concerned about different things. So we have kids that have different challenges, and there might be different reasons. Like it could be something that is a medical situation. That's why we always want to rule out medical things, where it could be a hearing issue, a vision issue, um, things of that nature, where it's like if maybe they got glasses, or maybe they had their hearing tested and they could hear better, some of these issues could be dealt with. Now, sometimes there's a speech problem, and different districts have different abilities for speech pathologists to be seen at home, or you go to a certain program, or maybe your kids start school a little bit early in a preschool program to get them ready to go. But these are things that parents need to address, which are really hard sometimes for parents. 3 to 5% of children are diagnosed with ADHD. Boys are more often diagnosed than girls. Hyperactivity, inattention, impulsivity. Not all kids have the same symptoms. And, you can have attention deficit disorder, or you could have with hyperactivity. And so maybe some kids have the attention deficit problem, but not with the impulsivity of hyperactivity. There can be some predisposition with this. Um, can they grow out of it? Yes, but a lot of them still have a problem in adulthood. I have a lot of clients that have used other things as coping skills to deal with their lack of um, their challenges with attentiveness, which haven't always been the best coping skills. And so it's something to be kind of conscientious of. Sometimes you can come up with really great abilities, like training kids on how to structure their lives, because maybe that isn't a natural thing. But if that becomes a learned thing, that even though some of those things are a challenge, they've learned how to cope with it in a positive way and just know for themselves that's something they're always going to have to do. Which is great when clinicians are able to help kids figure those things out. So there's different sorts of medications for ADHD. Like I said, there's some life coaching, counseling that can happen to help them with coping skills. Sometimes the school district will come in and help with the behavior pieces. But, that is something that can be dealt with medication. With medication, that's not something as a clinician we provide. So that's where you have to refer to a doctor, psychiatrist. It's always good to know a good child psychiatrist, because Again, you want to make sure this person knows about little people and what's best for them. Some places want to do specific neurological testing before they'll give kids um, any sort of, medication, which is great. I think that's good. And so parents might need to go through that process and need to, look into that sooner than later. Some of these things can be seen pretty early on in age. And for some things that come up, it's better to deal with them earlier than wait too long and then you almost like lose time. We have kids that, from 2 to 3 are going to an inland regional center and already starting to get services. And there's a lot of services out there for kids. It's just parents knowing what the services are that are available to them. Um, Kids are starting to, at certain ages, they're starting to begin to recognize words, um, trying to understand letters, and this is when there are certain milestones that kids should be hitting, and when they're not hitting that, that's when it raises a few red flags. Now, sometimes kids are slow in different ways. Just because they're not walking by a certain age doesn't mean, you know, that it's a problem if they're not walking by one or whatever. Now, that's where you have to listen to your doctor. If it gets past a certain time frame, then we have reason to believe. Now, if they're not walking and not doing this and not doing that, and there's a combination of things, always want to talk to a doctor. There's never anything wrong with talking to a pediatrician about concerns that you're having for your child. Never anything wrong with that. Always, always, always rule out anything medical because you never know what could be going on with somebody, and you don't want to be, encouraging them one way and really it was a whole medical problem that needed to be dealt with. Um, so much to cover in these few chapters. Please let me know, guys, if you have any questions. I don't want to go on too long. I know you guys can read. I'm not trying to question your intelligence. Again, if you have any questions, please feel free to reach out to me. Hang in there. We're almost to week 4, which is halfway through. Can't believe it. And I think that's it. So yay for week 3. Okay. Hang in there.